Hello, everyone. It is Wednesday, March 25th. I am in my basement recording your lecture for Chapter 12. So that's why you see weird things behind me. Okay, it's the only quiet place in the house right now. Um, I hope you're all doing well. I miss seeing you guys in class, and we will go ahead and get started. So just bear with me here while I get the screen going. Let me start to share here. Okay, hopefully you can see this. All right, so we are going to talk today about the liver, gallbladder, and pancreatic diseases and disorders. The liver, the largest solid organ we have in our body, believe it or not. It plays a role in many different things, primarily digestion, absorption, metabolism. It makes the substances that help when our blood clots. It manufactures chemicals, and it does store nutrients. It's not just an organ which most people associate it with just the digestion and absorption, but it does store very important nutrients for us. The gallbladder lies just under the liver, and it stores bile until we need it. Yes, bile tends to be a negative word, but we do actually need bile in our body. The pancreas lies behind the stomach. The important job of the pancreas is to produce and excrete most intestinal enzymes, which aid in our digestion. The primary disease with liver is jaundice. That is the main symptom. Let me rephrase that. The primary symptom we see in liver disease is jaundice. It usually starts in the whites of the eyes. They tend to get yellower and yellower. Then the face and the hands tend to look yellow the most. With gallbladder and pancreatic disease, there aren't a whole lot of symptoms that clue us into that other than pain. And then once we get someone to the healthcare system, we can do imaging and lab work to determine the gallbladder and pancreas issues. So some diagnostic tests. Liver function tests measure the bilirubin, the albumin, which is protein, and alkaline phosphatase. Alkaline phosphatase is a blood test, which is used for many different things in the body. So ALK-Phos is not just simply limited to the liver, but when the liver's not functioning, that enzyme tends to be high. Obviously, ultrasound, x-rays, and a CT scan, we can biopsy them. The best part for the pancreas, though, is there's a simple blood test to measure pancreatic function. So with liver disease, it can range from mild inflammation to diseases that destroy the liver and result in complete liver failure. Probably the biggest liver disease we see is the hepatitis family. Hepatitis, the word actually means inflammation of the liver, and it's caused not just by the viruses that we normally think of, like hepatitis B and C, but it can be caused by a chemical action of drug or toxic substances, anything that you can be exposed of. A lot of people get exposed to weird chemicals at work, and sometimes that can cause those problems. Chronic alcoholism is a main cause of hepatitis. But again, just because somebody has hepatitis, I don't want you to automatically think that they're an alcoholic. So when I talk about hepatitis now, I'm going to talk about the viral hepatitis. Okay, there are 5 types of them: A, B, C, D, and E. It's the most prevalent disease in the world. Hepatitis is the most prevalent disease in the world. It can range from asymptomatic to vague symptoms to complete and utter liver failure. A lot of healthcare workers have been exposed to hepatitis. I've talked before with some of you. I was exposed to hepatitis B. I never even knew I had an exposure. The only way I knew is when I went to donate blood after I had my first daughter. I got flagged that I had a positive hepatitis B test. which sent me into a flurry of concern because I had not donated blood since before I had been pregnant. I was worried about my baby. She was fine. I was perfectly fine, and I've been Hep B positive for almost 23 years now, and I've been very lucky. I've never had any problems with it. So we're going to start with them one at a time. Hepatitis A usually is very benign. It's spread by oral fecal contact. We don't see a lot of it here in the United States. We see it mostly in countries that don't have separate water supplies for their drinking water, their bathing water, and their toilet water. Hepatitis B was formerly called serum hepatitis because we knew that it passed through when someone came in contact with another patient's serum, but we weren't quite sure how. This one's pretty bad. It can live on surfaces for a long time, and it can be spread by blood, urine, feces, saliva, and semen. It's considered a sexually transmitted disease just because it can be secreted in semen, but it is not solely a sexually transmitted disease. Hepatitis C is spread by blood or sexual contact. It progresses very slowly and is usually chronic. And the best part about hepatitis C is that now we have treatments for it. There was a huge surge in hepatitis C in the 90s, which they traced back to getting tattoos because many tattoo artists did not use disposable needles. They used needles which they thought they were sterilizing between customers, but they were not. Probably the most famous person in the world with hepatitis C is Pamela Anderson. She was married to Tommy Lee, and they loved to go get tattoos, and that is one of the ways she got hepatitis C. So again, hepatitis B, we have a vaccine that can prevent it. If there's an exposure to hepatitis B, they start the vaccine immediately on that person because what they're hoping to do is generate antibodies to prevent it from getting serious. Hepatitis C, we can actually cure with medicine now. Hepatitis D is a very interesting one. Hepatitis D requires that you have had hepatitis B first. Then you get hepatitis delta virus, and it uses the hepatitis B virus to replicate. Very strange. You don't get D unless you've had B first. The last one is hepatitis E. It is also an oral fecal transmission, and again, it is commonly due to water contamination. Aren't you glad I make my goof ups here just like I do in class? So, any of the hepatitis, these are possible symptoms. Some people have some of them. Some people don't have any of them. I never had any of these symptoms when I was exposed to hepatitis B. I was very lucky. The first thing is usually it's just a general malaise. It feels like you have a cold and you just don't feel good. And when you feel like you have a cold and a fever, you automatically think, oh, it's just a mild infection. It can turn into a lot of pain and abdominal pain, muscle joints, dark colored urine, clay or light colored stools. And the final and most serious problem of it is when your liver starts to shut down, you get jaundice and liver enlargement. Treatment for it is rest, good nutrition, the antiviral medications. Again, we can do that for hepatitis C. Prevention, again, good hygiene, special care when handling needles and body fluids. Getting the hepatitis B vaccine is especially crucial to healthcare workers. Cirrhosis is an end stage of many other liver diseases. It's chronic, it's irreversible, and it's degenerative, which means no matter how much we treat it, it's not going to get better. That's why it's also known as end-stage liver disease. So what happens with cirrhosis is normal liver cells become replaced with non-functioning scar tissue, and you get when they image a liver, it gets like knobs like you would have on a cabinet or a drawer, and that's why it's called hobnail liver. That's a more common term for cirrhosis. The most common cause, again, for cirrhosis is alcoholism. Again, people can get cirrhosis without having been an alcoholic. The symptoms are loss of appetite, nausea, indigestion, weakness, muscle loss, weight loss. Again, these are things that we see in all kinds of just normal everyday diseases too. So if you start to see your eyes getting yellow, that's the time that people start to realize, oh, something's wrong and I better get to the physician. There are lots of complications of severe cirrhosis. Portal hypertension, the veins in the liver, the liver's portal vein stops functioning well. People can get esophageal varices, which are bleedings in their throat. Their spleen can become enlarged. Their GI tract gets ulcers, and sometimes they hemorrhage, which results in hematemesis or throwing up blood. You can get ascites, which is a deficiency in vitamins, very swollen because you're not processing the water correctly, and jaundice. Another very bad complication of severe cirrhosis is your sex hormones become altered. So a lot of times you will see female hair distribution, testicles atrophy, you'll see gynecomastia, palmaroarrhythmia, spider angiomas, and you can also get hepatic encephalopathy, which can cause delirium and a lot of tremors. The next disease I want to talk about is non-alcoholic fatty liver disease. This is a buildup of extra fat in the liver tissue. Again, people can have this for a long time and be asymptomatic before they realize there's something wrong. Once they do realize something's wrong, the healthcare focuses on treatment to prevent further liver damage. Liver cancer. Liver cancer, the prognosis is usually not very good. For a lot of cancers that occur in the other parts of the body, they tend to metastasize to the liver because almost all the cells pass through the liver at some point. Primary and benign tumors of the liver are rare, which means we don't see it often start in the liver. It usually is a cancer that has occurred somewhere else in the body and metastasizes to the liver. Once it gets to the liver, that's when patients get in bad shape. The diagnosis is by a biopsy. Again, to prolong life, to provide better quality of life, we can do chemo, we can do radiation. Sometimes they will remove cancerous part if they can. A lot of times they do not want to open these patients up to surgery because when they do open them up, the open abdomen causes the body to start circulating those liver cancer cells to even more places. So they try not to do surgery unless it would be a benefit over the cost. Cholecystitis. Now we're switching into the gallbladder. Cholecystitis is an inflammation of the gallbladder, and it's usually caused by an obstruction from gallstones. The symptoms are pain in the upper right quadrant of the abdomen. That doesn't mean that every time you have a pain in the upper right quadrant, you're going to have a gallstone, but it's a real good indicator for us. Remember, appendicitis is lower right quadrant, okay? So the first thing they'll do is they'll do an ultrasound. The biggest complication is if the gallbladder ruptures, it kicks out a bunch of, again, nasty stuff into the peritoneum, and it can cause massive infection and septicemia. So if someone has an inflamed gallbladder, they will, or they think it's going to rupture, they will remove it in a procedure called a cholecystectomy. Cholelithiasis. These are gallstones in the gallbladder or the bile ducts. And again, very similar to kidney stones, the symptoms, nausea, vomiting, the pain. We see it patients will often have a problem if they've eaten a meal high in fat, and the reason is bile isn't being secreted to help digest the fat. So if someone presents with that right upper quadrant pain, they're tender to the touch, they'll do some ultrasounds, and the gallstones will show up on an ultrasound also. This is just a graphic from your book that shows where the gallbladder is and how it connects with the liver and the pancreas, and how they feed into the lower portion of the intestines or the duodenum. So gallstones can clog those tiny little green pathways very, very, very quickly. We're going to switch to the pancreas now. Pancreatitis, inflammation of the pancreas. Again, commonly caused by alcoholism, but not the sole culprit. This is when people have severe abdominal pain and it radiates into their back. We don't know why it radiates into the back, it just does. Not only will they have nausea and vomiting, many times they're very diaphoretic, they're sweating profusely, and they have a very rapid heartbeat. The symptoms of chronic pancreatitis are very similar to an acute pancreatitis attack. The first thing they will do is draw blood work and they will test for amylase. So when they test for amylase, it'll come back high if there's a problem with the pancreas. Amylase is one of the enzymes that is secreted by the pancreas, and if it's not working, if the pancreas is inflamed, the amylase won't get secreted and it will be very high in the blood. The treatment and prognosis for pancreatitis, they will check for gallstones. They will do a cholecystectomy if they are there. It can be idiopathic. Again, remember, idiopathic is one of my favorite words, and it means there's no known cause. So what they will do is provide palliative symptomatic treatment. They will keep the patient as comfortable as possible, prescribe anti-inflammatories, and sometimes it will go away on its own. If it's due to alcoholism, the biggest thing is we ask the patients to quit drinking the alcohol. While it will not cure the pancreas, it hopefully will decrease the inflammation to the point where they can live with it. Pancreatic cancer is usually an adenocarcinoma, and it occurs in the head of the pancreas. The cause is unknown, but many carcinogens which are linked to pancreatic cancer are cigarettes, high coffee consumption, chemical exposure, and consumption of a high-fat diet. The symptoms are the abdominal and back pain, the nausea, vomiting, loss of appetite, weakness and fatigue, and jaundice. So you can see if somebody presents with these, we're not quite sure if it's a pancreatic disease or if it's a liver disease. So they have to do additional tests to kind of wind it down and narrow it into what actually is the cause. The only way they can diagnose pancreatic cancer is by the biopsy. They can try to remove it, they can radiate it, or they can use chemotherapy. Pancreatic cancer, very poor, very, very poor prognosis. These are just some rare diseases that affect the pancreas and the gallbladder and the liver. There's primary biliary cirrhosis. It's a chronic liver disease that destroys the bile ducts, which in turn, you don't absorb your fat the way you need to. Gilbert's syndrome is a congenital liver disorder. Remember, congenital means you were born with it. Hemochromatosis. This is when the body absorbs and stores excessive amounts of iron. We see this in people who take too many iron pills. There are people who think, oh, I'm tired, I'm anemic, I will just boost my iron, and they will take 5 or 6, 5 to 10, sometimes 20 iron pills a day, thinking that it's going to make them not tire. But what happens is we don't secrete that extra iron, and it builds up in the liver, and it causes a big problem. As always, we always finish with what are the effects of aging from these diseases? Anytime an elderly person has a problem with their liver, their pancreas, or their gallbladder, they are at increased serious increased risk to very serious infections. We try to encourage lifestyle changes to contribute to healthy outcomes. They are very susceptible to bile stones and decreased pancreatic enzymes, which cause digestion issues. So that is all that we have to do for this chapter. I'm going to stop sharing and I'm going to stop recording, and I hope you all are healthy and happy. Have a great day.